Hi guys, and welcome back to Spoonielifelover. I hope you're really well. Sorry if the lighting's not great in this video and the angle's not great. There's nowhere really in my house at the moment that is lighted very well to film this. And if I keep looking down, I have notes, so please excuse that. So today, as you can tell by the title of this video, I am getting round to filming my chronic illnesses video. This will be split into two parts. So part one will be the illnesses that are more chronic, the illnesses that affect me more. That's not to say that the part two illnesses don't affect me every day, because there are some days when they do. But I've just split them up like this because this is just the easiest way for me to film this video, okay? So I'm not going to rabble on too long because it'll probably be a long video anyway. So the first one I'm going to start off with is knock knees, which is a condition, I think its medical name is gnu valgum, but I'm not sure. You might have to Google it if you want to know. Is a condition where my knees in my legs knock together and my ankles are very far apart. So my legs, the knees go like that, and then my ankles go like that. So it's like a triangle shape. I was born with this. It's a birth defect, which is usually diagnosed in childhood, in young childhood, sort of like 3, 4, 5, when they first start walking, like pre-walk, like walkers. Unfortunately, mine was never picked up until I was 11, so I was very, very late being diagnosed with this. And the first operation I had is called a guided growth procedure, where I had 6 metal pins like that stapled into my bone, into my knee, to stop the bones from growing, which is supposed to allow your body to catch up and to try and reduce the space between your ankles, because a normal adult or a normal child should have sort of like anywhere from 2 to 5 centimetres between the ankles. When I got diagnosed, I had 27 centimetres between my ankles, and I now have 32 centimetres between my ankles. So that didn't work, and it's got worse and worse and worse. So the guided growth obviously didn't work, probably because it was done too late. I've had a number of procedures. My left leg is the worst leg. My right leg is my pretty normal leg. Like, there's a percentage that my knee is off, but it's nowhere near as bad as the left. My left is really, really, really bad. Because of the knock knees, because of the position of my patella, of my kneecap, because of the grinding of the position of it, because of the fact that it's unnatural where my patella is, all of those factors mean that I have grade 3, bordering on grade 4 osteoarthritis in my left knee. Now, there's only 4 grades of osteoarthritis. There's 4 grades, 4 being severe. I am very late grade 3, early grade 4. So if you're going in and looking at my knee internally, I'm only 29. My knee looks like a 80-year-old's knee would look, that's led a very, very, very active life. You know, the arthritis that's inside that bone is severe, really severe. This causes me so much pain on a daily basis, I can't even tell you. There are some days where I can't move because of the pain. It is that bad. It reduces me to tears, and I live with chronic pain from other conditions as well, so it takes a lot for me to cry and get upset about pain. But some days this pain in my leg is so bad that it is, you know, really severe. So the knock knees and the osteoarthritis in the knee are connected. I also have slight degenerative changes in my left hip, so there is slight arthritic changes in my hip as well because of the alignment of my whole body. I will end up getting arthritis in other places as well. Also, something that's a very new diagnosis for me late last year, so late 2017, is something called complex regional pain syndrome. Complex regional pain syndrome means that the nerves in your leg, well, any part of your body, it can happen from stubbing your toe to major surgery, having your leg amputated, for example. Mine is because I've had so much surgery on my leg. The symptoms of CPRS that I suffer with are my leg goes from being freezing cold, and I mean to the point where it could have been in a freezer, to the point where it feels like someone's dunked me in a bath of hot water, to having electric shocks running through my bones, to having a million spiders crawling up my leg. All of those four are the main four things that I suffer with the CPRS, or CRPS, sorry. It's very new to me. They affect me, that affects me greatly. It wakes me at night. It makes me smart with pain because of the electric shocks. It is very painful when your leg goes from being extremely cold to extremely hot, or vice versa. It hurts like hell. I can't explain that. That hurts. So there is medication for that, which I take. Sorry, I've got a very dry mouth from medication. There is medication that I take for that, which helps the nerves. Basically, the way my pain management team explained it to me is your nerves should look like spaghetti in your leg, and someone with CRPS, they look like scrambled egg. That's the best way to describe it, because of the amount of surgery that I've had and the amount of procedures that I've had and the amount of damage there is to the joints and things on my leg. My leg swells as well to triple the size that it should be, triple the size of my right leg, making wearing certain clothing very difficult, because the right leg of that clothing item will fit fine, but the left leg will be too tight and I won't be able to get it on. So that can be difficult. The next one, that's my leg basically. There's nothing they can do for me. I am currently trying to get my third opinion by a professor of orthopedics to see if there's anything that he can do. If there's nothing that he can do, then we are going to be discussing the route of amputation, above the knee amputation, because I feel that it would be better and I will have more quality of life living with a prosthetic or in a wheelchair than I would having than what I've got now. And please don't judge me on me saying that. If you want to know, ask me, because it's very difficult for me to explain to someone who your normal is not being in pain, my normal is being in pain, but there is a point where you get to where you think, I cannot do this anymore, and they want me to live the next 40, 50 potentially years of my life like this. I don't think I can do that. Strong mentally, physically, emotionally, I don't know if I've got that in me to do. So if there is another option, i.e. amputation, then the sacrifice that I'm willing to make is losing my limb to give me better quality of life. Does that make sense? So I would be on reduced amount of painkillers, I would be on reduced medication, I would have better mobility probably, I would have a better quality of life. I would be able to do more than what I can now with the leg that I have now. But there is a hell of a lot of hoops to jump through that is years ahead of me. You know, I've got to find a doctor that's willing to do that. So the next condition that I have is a autoimmune disease. It's one that not many people have heard of. It's called hidradenitis suppurativa. Yes, it's a mouthful. And it's a bitch of a condition to have. It is a skin condition. It affects your sweat glands. It affects areas such as armpits, groin, buttocks, breasts, anywhere that is sweaty and hairy. It's not a very nice disease to have at all. I've had it for coming up 19 years, possibly even longer than that, a long time. I have had over 16 operations on my groin to relieve symptoms of this disease. I have had at least, well, I'm not even going to put a number on it, I've had several hundreds of courses of antibiotics to cure the abscesses that the blocked sweat glands cause. I have had several hundred hospital admissions from this disease, and I've taken several different medications over the course of the last 6-7 years to try and combat the symptoms of this disease, all the way from industrial strength antibiotics on the daily, all the way up to now, what I'm on now, onto immunosuppressants, which I'm on a drug now called Humira, it's called alididimab. And what this does is reduces the amount of TNF proteins that my immune system produces, because my body produces too much of that protein, and it then attacks itself and sends inflammation to the areas of the body where there is no inflammation. So it will just attack itself basically and produce inflammation where there isn't any. So as you can imagine, the pain of this disease, and if you have HS, you know what I'm talking about. It is horrific. If you've ever had an abscess, you know what I'm talking about. You imagine having an abscess, then having had surgery in the same area that you've got an abscess. And when I mean by surgery, if you have an abscess surgery, they cut the abscess. Sorry if you're a bit squeamish, you might want to fast forward. They cut the abscess. They take out the inside of the abscess, all the gunge, all the pus, everything. They make a hollow cavity inside the abscess. Then they pack that hollow cavity with surgical gauze, and you have to go through the horrific agony of dressing changes until that wound closes over. So they can't just stitch it, because if they stitch it, the cavity will fill. So it has to heal from the bottom slowly up. Every day you change the packing, you put the packing inside the wound, and every day it grows very slowly and it comes up, and eventually you take the packing out and you allow the skin to grow over the top, and it hurts a lot. This disease creates scarring, it creates leakaging, it creates tunnels, it creates oozing, it creates painful sores, it creates the most horrific redness and itching to the skin, the burning of the skin. It is a horrible condition. I would not wish this disease on my worst enemy. It is awful. There's times where I've literally sat in a dermatologist's office and bawled my eyes out because I cannot take it anymore. There is surgery where you can have the whole of the area cut away, and you can have skin grafts taken from your buttocks, your thighs, anywhere that's healthy skin, and have that grafted. But because of the area that my HS affects me in, I'm not ready for that yet, and I don't know if I ever will be. But that is an option. But at the moment, touch wood, the Humira is working for me. I have been on the Humira for just over 3 months. If you are thinking of going on Humira, I would say, for me, go for it. The only side effect that I have had is a headache after my injection, and that lasts for approximately 24 hours, and then it eases off. but I suffer with chronic migraines anyway, so it could be totally different for you. However, I am aware that some people that have taken Humira have had horrific side effects because it is used for other diseases such as Crohn's, rheumatoid arthritis, and a spinal condition as well. I'm not sure how you say it. So there is, you know, a lot of uses. It's only recently been licensed for use in HS, so we are lucky to have had that. And so far I am very thankful to be on it, because it is making my life in that area a lot more comfortable. So if you want another video going into a little bit more detail about HS, if you want to know some of the dressings that I find the best, if you want to know some of the tricks of the trade, so to speak, for how I make myself more comfortable, if you want to know how I reduce some of my oozing and smells, because let's be real, pus smells, if you want to know that, I'm quite happy to make that. Just let me know. Like I just said, the next one I'm going to talk about is chronic migraine. When I was 18, I used to work in a nursery. I'm a fully qualified nursery nurse, and I unfortunately contracted meningitis when I was 18, and it's all started from a bump on the head at work that I received, and I was extremely lucky that my parents found me. I was unconscious and they found me, and that I was transferred to hospital, and I was extremely ill. I was in intensive care for a few hours, and a few days actually, it was a couple of days, and I was really very poorly. Luckily the antibiotics worked, and luckily I only had viral meningitis. I did not have bacterial, because if I'd have had bacterial it would have been a whole nother story. But the lasting side effects, and I'm very grateful that I only had viral. I know that sounds a bit silly, but I am very grateful for that. The lasting long-term effects, if you like, of me having had that condition is the fact that I now suffer with chronic migraines. These affect me on a different days, different months. It depends how long's a piece of string kind of situation. I 1 month can have 5, 6, 7 migraines a week to having 5 a month. It really just depends on what's going on in my life, how I'm feeling, things like that. It's controlled by daily medication. I take 2 lots of different medication to try and prevent a migraine, and then I have a actual migraine preventer that I take when I first feel the signs of a migraine, and then I also take paracetamol as and when needed, just to see if that helps, and it does help. I do suffer quite badly from tension headaches as well, and I do need to go and get my eyes tested, which is being done in a few days, so that should help with the headaches as well. But it's just something that I've been prone to since the meningitis, and the neurologist, we don't really know why. Could be the fact that I did have some brain swelling, we're not sure. And the last one I'm going to talk about today is something called supraventricular tachycardia, SVT. This is a relatively new diagnosis for me. I've only been diagnosed with SVT since May 2016. I had a 6 months before that of a very, very fast heartbeat. My resting heartbeat was beating anywhere between 180 and 200 beats per minute. And I was waiting 6 months to see a cardiologist at the time. The reason we have found out that I have SVT is because I have had over 30 general anaesthetics in my life, and I'm not even 30 years old yet. So the amount of anaesthetic that I've had has damaged my heart in some way. We're not sure how and why, but just the fact that in some years over the past 6 years of my life, some years I've been in theatre up to 10 times a year, so that's really not going to help your heart. And that's the reason, also probably because of the amount of painkillers and things like that I take. It is controlled with a daily beta blocker. I take one in the morning and some at night as well, and luckily it is controlled. The only time I ever do have any problems is if I get ill, if I get a virus or bacterial infection of any sort, or if my pain is extremely bad as well, then that does lead to me having quite bad runs of SVT. But most of the time it is controlled. But if I didn't have SVT or my heart didn't beat faster when I was in pain, I would be worried, as that is a natural human reaction to pain. So that's it for today. If you don't think that I went into enough detail about anything, do let me know. If you've got any questions, do let me know. If you'd also like a sort of medication tour of what medication that I take on the daily, again, I'm happy to do that. If you want to, if you're just nosy and want to know what medications I'm taking, let me know. If you want, like I say, an extra video about any aspects of my leg, if you want me to talk about that, if you don't understand anything, please don't be embarrassed or afraid to ask. I will answer your questions. If I feel it's appropriate, I will answer. So that's pretty much it for today. There will be a part 2 to this video where I will talk about some other conditions that I have. Like I say, they don't, just because it's in part 2 doesn't mean it doesn't affect me as much. It just means that I've split this video up to prevent it from being too long. So it's already over 20 minutes long. So I hope you enjoyed this video. Thanks for watching. Like, subscribe, share, all of that jazz if you want to. And thank you for stopping by. So I will see you all soon.